you a couple different movements that I use for hip mobilization. One of the big problems is in a lot of our day-to-day activities and in the gym, a lot of our movements with our lower body and in our hips in particular are just flexion extension. We're just kind of moving in the sagittal plane, just kind of up and down, front and back. We're not really utilizing a lot of the lateral movements or a lot of the rotation that's allowed from the ball and socket joint, if you're familiar with the anatomy of your hip, right? So there's a lot of degrees of freedom in that hip joint. We want to make sure we're utilizing that for overall joint health. So first thing I'm going to show you here, this is a pretty easy one, pretty approachable for most people. What I'm going to do is we're working internal and external rotation on each leg. So I'm putting my one leg like so, my other leg, the foot's going to be right at the top of that knee. Now, we're probably going to feel a little bit of a pinch or a little bit of discomfort here, so you can lean back to make that a little bit easier. Usually I'll say try to sit upright as much as possible or as much as is tolerable. From there, what we're going to do, my feet are staying in the same position and I'm just rotating through the hips. Okay, so I'm just going back and forth with that. Again, at each end, I'm trying to sit up into that internally rotated hip a little bit more, right? If this is a little bit tough for you, as it probably will be if it's your first time, you can lean back, you can put some weight on your hands, and that'll kind of mitigate any pressure or tension that you're feeling now, okay? So just working your way back and forth. You know, I might do a set of about 10 pair or so. Loosen those hips up nicely. The second thing I'm going to show you, this is a little bit more advanced, so maybe not for everybody. What I'm going to be doing is what's called a Cossack Squat. So I'm just going to be going back and forth. So in a wide stance and just shifting my weight from one foot to the other. So we're getting some good lateral movement here. And what we can do to step things up is when I'm out at one end, I'm going to take my extended leg and I'm going to turn that toe up. So I'm getting some external rotation through that hip. And what we can also do is work on the internal rotation. So I'm turning onto my toes. If you watch my left foot, turn into that, and then I can also go into a hip flexor stretch. So I'm keeping tension on this glute. I'm trying to make sure that I'm not arching too much with my lower back. So keeping tension on my glute, keeping tension on my abs to keep my spine straight and my hip extended, right? And then I'm just going back and forth into that. Usually I'll go to hip external rotation again, shift over, do the same thing. So externally rotate, internally rotate into a hip flexor stretch, reach up nice and high, come back into external rotation and switch. One other thing you can do if that's a little much is grab a dowel, and then that can kind of take up a little bit of the weight for you. On this leg that you're crouching down on, if your heel comes up, it's not the end of the world. Usually I try to keep it down, but if you're having a hard time due to maybe lack of ankle mobility, it's not the worst thing in the world. Anyways, give them a try and see how your hips feel afterwards. Thanks for tuning in.